Good afternoon, Miss. I am Arsen Vine M. Caban from BSN2 Waidenbach, and today I am going to perform administration of oral medication. So what is administration of oral medication? Administration of oral medication is the giving of medication to be swallowed through the mouth. Gather equipment. Check the medication order against the original physician's order according to agency policies. Clarify any inconsistencies. Check patient's chart for any allergies. This comparison helps to identify errors that may have occurred when the orders were transcribed. The physician's order is the legal record of medication orders for each agency. Know the actions, special nursing considerations, safe dose ranges, purpose of administration, and adverse effects of a medication to be administered. Consider the appropriateness of a medication for this patient. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to patient's disorder, and this can also be used to educate the patient about the medication. Perform hand hygiene. Hand hygiene deters the spread of microorganisms. Place medication on a tray or move the medication cart outside the patient's room or prepare for administration in the medication area. Organization facilitates error-free administration and saves time. Transport patient's medication to the patient's bedside carefully and keep the medications in sight at all times. Careful handling and close observation prevents accidental or deliberate disarrangement of medications. Identify the patient by checking the name and identification on the patient's identification band or ask the patient to state his or her name. Identifying the patient ensures that the right patient receives the medication and helps to prevent errors. Good afternoon. Ako guys, Nurse Vine. Pwede ko ma-check yung mga identification band? Pwede mo ma-state mo yung sir?
Anthony Tigihanon.
Thank you, sir. Step 7. Explain procedure to the client to gain cooperation and to allay anxiety. Good afternoon, sir. Ali ko liwat. Bale, mag-perform ko sa mga subong oral medication. Bale, may natag ko sa mga bulong. Inon mo, sir, pag hindi ko pag-iluan, ha? Okay, thank you. Assist the patient to an upright or lateral position. Swallowing is facilitated by proper positioning. An upright or sideline position protects the patient from aspiration. Sir, wag kong konta, sir, ha? Sige, sir. Thank you, sir. Administer medications. Offer water or other permitted fluids with pills, capsules, tablets, and some liquid medications. Liquids facilitate swallowing of solid drugs. Some liquid drugs are intended to adhere to the pharyngeal area, in which case liquid is not offered with the medication. Ask whether the patient prefers to take the medications by hand or in a cup. This encourages the patient's participation in taking the medications. Remain with the patient until each medication is swallowed. Never leave medication at the patient's bedside. Unless the nurse has seen the patient swallow the drug cannot be recorded as administered. The patient's chart is a legal record. Only with the physician's order can medications be left at the bedside. Sir, are you water, sir? Ano prefer niyo, sir? By hand or by cup ka mag-inom sa gulang?
By hand.
Okay, thank you. Thank you. Perform hand hygiene. Leave the patient in a comfortable position. Hand hygiene prevents the spread of microorganisms. Sir, pwede ka makayo, sir? naman, sir? Comfortable ka naman, sir? Okay. Thank you. Check on the patient within 30 minutes or time appropriate for drugs to verify response to medication. This provides the opportunity for further documentation and additional assessment of effectiveness of pain relief and adverse effects of medications.